Hi everyone, happy Wednesday. I hope you guys are having a great day so far. I am back and today we will be talking about masks yet again. I want to say thank you for tuning in, and of course I appreciate all of you guys and the kind words that you have sent my way over these last few months, both through social media posts as well as in person. And so, as the title mentions, we will be talking about masks today. And in order to kind of show you that masks are okay and they are safe, I will be talking with my mask on for the duration of this Facebook Live. And I know a lot of you have been reading articles or posts or videos saying that masks cause a decrease in oxygenation. So I went out and I bought this little pulse oximeter. And this is not a hospital grade pulse oximeter. It's $30 on Amazon. I don't recommend that you purchase one of these, but I wanted to prove a point to you guys that masks are in fact safe. What this pulse oximeter does is it measures the oxygen level in my bloodstream. Normal is 94% and above, and you can see with my mask on right now as I'm talking, I'm at a 99%. To be honest, I wouldn't say that 100% is better than 98 or 96. When I see a patient in the office who's 94, 95, I do kind of start to think a little bit more about what's going on. But as you can see right now, I'm at a 99, and we'll see what happens as I keep on talking with my mask on. I actually don't know because I just opened this out of the box a few minutes ago. So it's a little bit of an experiment, and maybe we will all learn together. So the reason that I wanted to talk about masks yet again is that about 6 days back, Governor Newsom issued an executive order mandating the use of masks while out in public. And one thing that I found frustrating when the shelter-in-place order came out back in March was that there weren't a lot of guidelines to help us figure out what should we be doing and what shouldn't we be doing. And people took it to all different extremes. And so in order to avoid that kind of confusions with the mask, I thought that I would use this platform to share a few details with you about who should be wearing the masks, what kind of masks we can use, when and where and why we should be using these masks. So before I get started, I'd like to kind of address a few of the counter arguments that you may have heard recently about why we shouldn't be wearing masks. And the first one is that coronavirus is so small that it will seep through your mask and wearing the mask is pointless. Well, it's not pointless, but I will say that part of that statement is in fact true. Coronavirus is 0.06 to 0.14 microns in size. That is very, very small. And so if an infected individual who has COVID-19 and is not wearing a mask were to cough in my face, many of his or her viral particles that are living in his or her respiratory droplets will likely enter into my system as I breathe in. But if I were wearing a cotton mask, or maybe even my N95, the amount of the virus that I'm exposed to from him will decrease. But if it's a cotton mask, it's a very slight degree in how much it's going to decrease. And even if I'm wearing the highest grade mask that we have access to, which is an N95, there's still going to be some degree of viral particles that get inside of me, because even an N95 can only filter out 95% of viral particles that are 0.3 microns in size. And remember that COVID-19 is 0.6 to 0.14 microns in size. But if that infected individual is wearing a mask, he keeps much of his respiratory droplets to himself. And if he doesn't share his respiratory droplets with me, he doesn't share his virus with me. Now, some may say, how do you know that a face covering will actually prevent the spread of respiratory droplets? Well, part of it is common sense, right? This is what we've been taught. Cough into your arm, cough into your mouth, wash your hands thereafter. And obviously a cotton face covering is going to further decrease the spread of your viral particles. But if you'd like to get technical, there was actually an excellent NIH study that was cited in the New England Journal of Medicine, which showed the efficacy of face coverings. It was a laser light scattering experiment in which speech-generated respiratory droplets and their trajectories were actually visualized. And there was essentially no trajectory when the masks were worn. And I'd be happy to give you that information and a really cool video that came along with that study. Now, no masks are foolproof in terms of preventing spread of infection, but it will dramatically slow down the number of cases that we're having, and more importantly, the number of deaths that are occurring because of this virus. And so the bottom line is that if I wear my mask, I protect you. And if you wear your mask, you protect me. And while it is important to remember that with these rising number of cases and hospitalizations and deaths, there's more implication that goes above and beyond that person and that person's family and the healthcare system. I personally find it really unlikely that business as usual is going to continue for our schools, for sports, for local small businesses, and for hospitals if we continue on this trajectory. For example, just take a look at what's happening in professional sports. They keep trying to get it off the ground, and yet they keep having more and more individuals who are positive and more individuals who don't want to play against the positive patients. And it seems that they're just circling, right? And take a look here in town with some of our small businesses who have had to temporarily close because a service worker has been found to be positive. Our kids, particularly, they've already been out of school and their sports for long enough. So why on earth would we set them up for failure in August? I firmly believe as a pediatrician, our kids really need to go back to school. They need to learn from people other than their parents. They need to socialize. They need to have those relationships. And we are digging ourselves in a grave right now by not uniformly wearing masks and causing our numbers to surge. So again, this is such an easy solution, and we can all be part of that solution. So, issue number 2, wearing masks are dangerous. Well, let's talk about surgeons and anesthesiologists to start with. Your average surgery is about 3 hours in the United States, but it can vary from literally 30 minutes to 18 hours. And surgeons and anesthesiologists are in their masks every second that they are in the operating room. They are usually tending to several cases per day. They often work 3 to 7 days a week after week, month after month. How come nobody seems to worry about their well-being? And how many surgeons or anesthesiologists have given up their careers because they found that wearing their mask was dangerous or too hard or uncomfortable? Not very many of them, as far as I know. And currently, let's think about every single medical establishment in every single city in America where every single employee is wearing a mask. We are all in our masks in my office the entire time that we're there, and yet none of us are keeling over from lack of oxygenation. Next, let's talk about Asian countries. The 2 countries who have the longest average lifespan of 81 to 82 years are Hong Kong and Japan. No, is that right? No, yes, Hong Kong and Japan. Singapore and South Korea, 2 more Asian countries, are also in the top 10. And it's no secret that Asian countries have been wearing masks for far longer than we have, and it really doesn't seem to be adversely affecting their population as a whole, since they're the ones who are living the longest, right? Now, some people have cited the story about 2 boys in China who died while wearing their masks. Both of them were running with their masks on, which we'll definitely talk about. And the details of the story widely vary. And as we've seen over these last few months, China hasn't exactly been forthcoming with all of the information that they have and what they're sharing with us. So I think that we should take that story with a grain of salt, and certainly we will talk about who should be wearing the masks and when we should be wearing those masks to make sure that people remain safe. Next category, let's talk about people who are immunocompromised because of cancer, chemotherapy, organ transplantation, autoimmune conditions, or because they're being treated with certain medications. Many of them have been wearing masks out in public for years. Are there any widespread problems there? Not that I'm aware of. And you can argue that some of those individuals are the most fragile in our population. So why on earth would their doctors be recommending a practice to them that could be hurting their oxygen levels, right? Okay, and then you've probably heard, as I mentioned earlier in this video, that masks cause oxygen deprivation. And here we go, we're still at 99%. If you've been watching the pulse oximeter during the duration of this video, so far, nothing's happened. And this is an N95, so this is far more constricting than the typical cotton mask that we'll talk about in a little while. So when we talk about face shields and coverings, we're talking about something that is comfortable, a little bit loose fitting. It doesn't have to be as gripping as an N95, and it certainly is not on the order of a gas mask. There is definitely going to be a period of adjustment. And I will tell you, when this all started and I had to start wearing N95s in the office, I could barely finish a clinic visit without having to come out and take a breath because my body was not used to it. But our bodies are incredibly amazing and complex machines that will adjust if you give it time. And by the end of the week, I was carrying out my clinic visits as usual. And you can see here, I'm not sure how many minutes we're into this, but I really haven't had a hard time continuing to speak with you. And as you've noticed, my oxygen level is not coming down as we speak. And I will tell you that, sorry, I lost track of what I was saying. This is really not causing any serious damage. And you've noticed that it's not a new phenomenon for certain professions, for certain countries, or certain patient populations who have been doing this for far longer than the 1 week that our governor has been asking us to do this. And some are saying, well, it's not the oxygenation problem. It's actually that you're breathing in your own CO2, and that can cause your blood to become very acidic. And that is not something that you would be able to see on this pulse oximeter. Well, folks, this is where my nephrology background comes into play, and I would be happy to talk about acute and chronic renal compensation in the face of respiratory acidosis. It's a bit beyond the scope of this talk because it is very technical, but trust me when I tell you that our kidneys are far, far too smart to let something like a mask or a face shield to allow our blood to become acidic. It starts to make compensations almost immediately if it notices that you're breathing in your own CO2, and the pH of your blood will remain normal when you are wearing a loose-fitting mask or even an N95. So now, let's get on to the good stuff. Who should be wearing these masks? Well, almost everyone, right? But certainly children under 2 should not be wearing the masks, partially because they're not even going to be able to keep it on, but also because they have a higher respiratory rate, and our job is not to harm anyone with these masks. I understand that kids under the age of 8 are going to struggle with these masks. But quite honestly, as I mentioned in my other videos, we've taught our kids how to wear pants and socks and shoes and underwears. And as women, we've learned how to wear bras. So I think we can teach our kids how to wear masks too. I have seen kids in my office that are just amazing troopers. They wear it, and it's because their parents have taught them that it's the right thing to do and that it's important. Yes, they might mess with it a little bit, and sometimes it crawls up too high or it crawls up too low, but this is part of the learning process. This is something new that we are teaching one another, and it's okay if it's not perfect right from the get-go, but it is something that we have to start to teach our kids. Now, other people who should not be wearing their masks include certain medical conditions, mental health conditions, or a disability that would prevent them from wearing the cover and breathing normally during that process. And again, if these folks can't wear masks because they struggle to breathe in one, how on earth are they going to tolerate COVID-19 or a ventilator? And I personally think that we should be making a small sacrifice to help those who literally can't wear a mask because of their asthma or their COPD or their anxiety. Because as you can see for me, it's not very distressing. I'm not having a hard time breathing. I'm not anxious. So why can't I just wear my mask to then take care of those who can't wear their mask right now? Okay, next. What kind of mask should you be wearing? Well, this is important to try on different styles. Just like you do with your clothes, you want to find something that's comfortable and that's breathable. An N95 is not exactly breathable, but I absolutely love my cotton mask as well. And so when I am out and about and not at work, I actually wear that one. And it breathes well. It's not too tight. You may also want to figure out, do you like the ones that go behind your ears, which I personally do, or do you like it when it goes behind your head? Do you like the stretchy material, or do you like to tie it so you can determine how tight it is? I found that a 2-layer mask is actually really effective. So it's mine, for example, has this pattern, and then it's got a different pattern on the inside. And you also want to make sure that it stays in place and it's not moving around, because again, we don't want to be touching our face so much. You want to get into the habit of getting used to it and not touching it. But again, that takes practice. You're not going to be perfect at this when you first start. And one thing that is that in terms of disposable versus cotton masks, I don't think that there's a big difference in terms of reduction of spread of this virus, but I will say that a disposable mask every day, if we were all to be wearing them, would certainly be doing a disservice to the environment. And last but not least, finding the right mask for you is going to take some effort and it's going to take some investigation. But as you've already seen on social media and commercials, there are so many different masks out there right now. Talk to your friends and look on social media, maybe even post on social media and say, what masks do you like? And see what people have to offer. There are so many amazing seamstresses out there right now that are willing to make masks that it's a wonderful way to try them out and see what works best for you. Another question somebody asked me is, should your mask have a filter in it? Well, as we spoke, a simple cloth mask, the purpose of that is to protect others, but it really doesn't protect you very much. And so if you want to add an added level of protection to your own mask, you can put in a filter. And I have heard of all sorts of different filters being used, from coffee filters to vacuum filters. And one that I have found are these little blue guys. These are car shop towels. So if you go onto Amazon or Google and you put in car shop towel, these will pop up. And you can cut them to size, and you just slip them in on the inside of your mask, and you can cut them to size so that they fit well. And then you can dispose of them at the end of a day if you have been wearing your mask for a long time. And these filters will then further decrease the amount of the virus that can get through your own mask and potentially infect you. So next, when and where should you wear a mask? Indoor places where you cannot maintain a distance of 6 feet from other individuals. So we're talking about your grocery stores, your retail stores, banks, pharmacies, when you're in a restaurant and you're picking up takeout. In my opinion, I would not recommend wearing these masks when you are outside, particularly when it's 90 and today 100 plus degrees. Just keep 6 feet away from people. If it's so hot outside and you are somewhere that you can't stay 6 feet away from someone, in my opinion, that's the time to perhaps rethink what you're doing. And I honestly can't think of anywhere in town right now where it's over 100 degrees today where I couldn't go outside and maintain a 6 feet distance from other people. I personally feel that you really don't need to wear your masks outside regardless of what activity that you're doing, as long as you can stay 6 feet away from people. And this includes gardening, walking, swimming, running. You just need to be able to keep your distance. I do not recommend wearing your masks while exercising. I know people have gone back and forth about this, but I think this would be a big problem, particularly for those of you who exercise at a very intense level. You also don't need them when you're driving in your own car, unless you have someone in your car that you don't live with or that has asked you to wear their mask just to keep things safe. Others asked me, what about in the workplace? So masks should be worn in the workplace in common areas where people might be close together, like in meeting rooms or public restrooms, the break rooms, hallways, elevators, etc. But if you have an office where you are a little further away from people, or you can have a door that closes you off from everyone else, I think it's fine to take your mask off and put it back on when someone enters into your area or your desk or your office. And then what about restaurants and bars? Because we all know those are open now. And obviously it becomes quite difficult to ask people to wear their masks when they are eating and drinking. So this technically is another exemption if you look at the CDC guidelines. I'm not saying that it's not a risk to take off your mask in bars and restaurants. I'm just saying that you can't ask people to wear a mask when they are simultaneously trying to eat or drink. So last but not least, people were asking me a few things about mask care basics. So does your mask, like these little cotton guys, need to be washed every day? And it kind of depends, to be honest. If you are in a high-risk area where you have lots and lots of people kind of that you're talking to, and you're wearing your mask for several hours a day, you're probably going to want to wash it. But if you wear it for 30 minutes a day when you go into the grocery store, and maybe you're only wearing it once or twice a week, you can honestly probably get by with washing it once or twice a week. And as gross as it sounds, the smell test will help you. If your mask smells bad when you put it on, it's time to wash it. I've actually found that chewing gum while you're wearing your mask makes your mask smell a lot better throughout the course of the day. And my other piece of advice is just don't plan on eating or drinking during a mask-required activity. So if you know me, you know that getting Starbucks and walking through Target was one of my favorite activities on a day off. Well, now I just get my Starbucks after Target so that I don't have to keep messing with my mask, pulling it on, pulling it off, trying to drink my drink, touching my cart as I'm pushing through the store. I just enjoy the drink when I'm done with my grocery shopping so that it tastes better and I'm not putting myself at risk by touching my face, going on and off with my mask. And that is actually about it for today, you guys. And I think you've noticed here that my pulse ox has ranged anywhere from about 97 to 99% throughout the duration of this video. And I will say, you know, I'm a healthy middle-aged woman. I can't say that everybody who's going to wear a mask would be exactly where I'm at, but I do feel that for the great majority of us, masks are absolutely safe. They are not going to cause a decrease in your oxygenation level, and they are not going to cause an increase in how acidic your blood is. What they are going to do is it is going to help us to reduce the spread of this virus. It's going to reduce our number of cases, our hospitalizations, our deaths, and it's going to allow us to get back to life as normal, which is what we are all so desperately seeking. So I hope you guys have a wonderful rest of your Wednesday. I hope this information was useful to you, and I will see you next time. Take care.